Well, thank you again, everybody, for joining us on this episode of Vital Stuff, which is definitely going to be interesting and fun because we've got Dr. Karen Parker-Davidson with us today. And I'm super excited about it because no one knows more about the nose than Dr. Karen. So, for me, obviously, I'm a breast surgeon and I come from a
Mhm.
place of health really and trying to stay healthy, and preventive medicine is now really what I'm focusing on. And I think our paths crossed thanks to Dr. Keith Matheny, um,
They did.
ENT to the stars
Mhm.
in Dallas.
Mhm.
But do me a favor and just give us a little recap because your resume is so long and so meaty that if I had to do it, I'm sure I would leave something out. I would butcher it because there's a lot of meat in there. So
Yeah.
give us a recap of all of the amazing things that you've done, your training, your extensive clinical experience.
Mhm.
It's just really impressive.
Thank you. So I've been in clinical practice for 34 years, and I always say don't do the math because then you'll know how old I am. But I've been in the medical device industry for about 28, 27 years. So my beginnings began in the OR, PACU. I was in nursing school at Chapel Hill, UNC Chapel Hill, and I thought that I wanted to be a nurse anesthetist, so I applied for the nurse extern program. And I worked in the recovery room to really kind of get a back view, backdoor view of what anesthesia would be like. And if you know me, I could not sit still long enough to pass gas. So I stayed in the recovery room, graduated, went to MUSC in Charleston, South Carolina. And I was their first ever new graduate in the recovery room, got my certification in critical care nursing, then got my commission in the Air Force Reserves as a flight nurse, went to the School of Aerospace Medicine, got a few master's degrees, found myself back in the OR after children's mental health and a little bit of pharmaceutical background. Went into the OR again in the ENT world in 2002. So that's where I got my passion for ENT. But I think the airway portion really hit home through the industry travels of sleep medicine and home sleep testing and oral devices. I think it really hit me when in 2017, I came on board GM Instruments and found flow and pressure measurements and realized we weren't doing this in clinical practice. So in my ENT travels, I saw over 8,000 ENT cases in the OR and in the offices to realize this wasn't being done. So I flipped the script, probably a little disruptor, to look at nasal function, nasal flow, and why this is so important in what we do. Because ultimately we can breathe, but you can still have functional problems in your nose. So that's what led me to my point here. And I got frustrated with the medical industry, so I wrote a book about it. So, but that's kind of the brief cliff note version that I have so far. So far.
Well, thanks for that recap. And first
Hmm.
off, I want to thank you for your service um, to our country, and on behalf
Thank
of
you.
all of us, thank you. Very impressive background. And I think it's important for people to understand that people like yourself who has an amazing
Hmm.
career and you've accomplished so much, it's not a straight line. A lot of it is following your passion, and
Hmm.
it will lead you to ultimately your destiny. And I do want to come back to your book, but we'll get to that a little bit
Hmm.
later because that's another accomplishment that I think is so amazing. Now, believe it or not, most people know nothing about rhino-manometry. And so I want to unpack a little bit about that. Rhino
Hmm.
obviously is the term for the nose in,
Right.
I believe, Latin.
Hmm.
Um, and our friend the rhinoceros is a great example of that. And so
Hmm.
rhino means nose. And manometry is the study of basically the pressure, correct?
Right.
And
Hmm.
yeah. And there really is not a good way to monitor the pressure or the airflow going in and out of the nose. It tends to be relatively passive.
Hmm.
Certainly correct me if I'm wrong, but we don't think about our noses unless we are actively thinking about breathing through the nose. That's
Right.
different, right? But we're
Right.
always breathing through our nose. So, talk to me a little bit about first the normal circumstance of how much we're breathing through our nose. What the hell is going on there? And, how it's all connected and how the nose is the gateway to our lungs and really the gatekeeper for our
Right.
health.
And that's what's so important because in the recovery room, the way I would take care of a child and their airway issues was completely different than an adult. And you know this as well as a surgeon. How we intubate, how we look at respiratory, blood gases, all of those different, metrics in airway and recovery and under anesthesia are completely different between a child and an adult. So that's the first thing we have to really separate. But rhino-manometry, like you said, is rhino, the nose, and then mammometry is pressure. Now we have a little bit of resistance always to slow down the air for humidification, filtering, and for warming. We have to because we have to hit around this level in the back of the throat. We have to hit, and it usually hits around 95% relative humidity. Well, why is that important? When I was flying, I would never, ever, ever do CPR or bag somebody on the flight line in the wintertime because you give that cold induced spasms of the bronchioles and then you kind of make things worse. So, that warming to the lungs is so critical important for gas exchange, perfusion, and so forth. So, we have a little bit of resistance. We have about 0 to -5 millimeters of mercury of pressure always in our nose, and resistance is a constant. So we have to separate. Nasal congestion is rather acute, short term. Nasal resistance is very slow, very sneaky, and very insidious. And it's cumulative over time. So you think you're breathing well, but when you get to my office and I look at you and I look at your face and I do Maverick on you, my little own Maverick nasal exam, that tells me that you've had a problem for a long time. So what do we do? So, we have our signs and symptoms and what brings you to our office today. And I look at people and I look at the face. I look at the eye symmetry, the jaw, the ears, even their posture and shoulders. And that will tell me a lot. And what's a really telling sign is a deviated septum. Now, 70 to 80% of us have some form of deviation, but I categorized it into 5 categories based on parameters of percentage. So, like from 0 to 10% of a deviation from the middle, that's going to be pretty common. We really don't do anything. But as that deviation worsens, so does what we call the partition of airflow. Now, we basically have two noses. So, we want a 50-50 partition of airflow for equal airflow. But the more the deviation occurs, the less that partition is, the more resistance you get, the more difficult it becomes to really actively breathe and have that proper oxygen uptake and intake. Now, that being said, we have airflow coming in against a pressure gradient already there in our nose. But as that pressure increases, like a hurricane, that's why I said in my book, it's kind of like a hurricane. As that pressure changes, so does the amount of resistance. But here's the caveat. Everyone says, well, I'll make my nose bigger so I can have more air coming in. And that's, oh, in orthodontics, yeah, they want it wider. So in orthodontics, they'll do expansion, right? And they want that nasal. So we have 3 vaults. The first vault's the bone or the bridge of the nose. The middle is the second vault, which is more cartilage. And then the third vault is here, the more fleshy tone. And this first 1 inch is where most of the resistance happens. So, for example, in orthodontics, they'll do expansion, like a transverse palatal expansion. And they want to widen the first vault of the nose. And I just had an orthodontist, he was like, KPD. Thank you, Dr. Matheny, for that nickname. But he messaged me. He's like, KPD, look what I did. The patient's great. And I'm like, well, kinda. And he went from like 19 millimeters width to 23 millimeters. And I said, okay, so what? And he's like, wait, but I did a structural change. And here's the key is that 1 to 2 millimeters of a structural change can completely change that trajectory of airflow. So you think you're doing well by the patient with your treatment, but you can actually have a little bit of a reverse effect. And here's why. Resistance. We need it to slow down that air, right? When we breathe through our nose, we have about 80% relative humidity to here where it gets to 95% relative humidity. Not too long of a travel and not too much effort to get that humidity up. However, when we mouth breathe, we're at 60% relative humidity and a very short runway to the back of the throat, right? So now you can see how these changes will affect relative humidity, filtration, and warming that air and humidification. But I want to go back to that concept of volume. Volume, meaning the width of the nasal cavity, does not equal function. Now, it's kind of contradictory to what we believe or what we would do in practice. But here's why. The more you widen that nose, the more you're going to change the velocity or the speed of the airflow coming in the nose. And the more you're going to have an impact on what's called Bernoulli's principle. And that's basically saying if you increase it by so much, you'll have X amount of increase in airflow and a lower resistance. But the body is smart enough to know, hang on, don't get too excited because I have to slow this air down. And if you make too wide of an area for airflow, the body will recreate resistance. And it's usually at the glottis level. So with your patients in orthodontics, for example, you widen that nasal cavity, you think, and they say, hey, I'm breathing better, I'm sleeping better, sleep study looks good, AHI is coming down. But then a little bit down the road, they come back and go, oh, I'm having my clinical symptoms of upper airway resistance, which occurs primarily in the nose, is returning. And that's what I coined as pseudo UARS or a P-UARS. Well, what is that?
Be- Before we get into all of that, let's digest a little bit of what you've said here, because
It's a lot.
there's so much. That's a lot. And I kind of want to simplify it and say breathing is essential to living, right? Because you
Absolutely.
can live without food, you can live without water for a while, but you cannot live without oxygen. And so what we're talking about is actually breathing in the oxygen from the air, whether it's through our mouth or through our nose, and they are different, as you pointed out. Humidification, which is moisturizing that air so that the exchange in the lung of oxygen going into the bloodstream and being picked up by our red blood cells is efficient. And that's the process of breathing and breathing life into our body. So what we never think about, and what I just really oversimplified, is a massive amount of science that you just described in a nutshell as well. And it does have a lot to do with anatomy and the function of the nose, the mouth, and the lungs, and how they're so intimately connected. And again, it's something that we rarely, if ever, think about.
Yeah, and I would say, Dr. Gail, that's why I always say that the nose is its own reactive organ. And in book number 2 that I have coming out in October, I broke it down literally into 60 functions of the nose. I mean, I really took a deeper dive into it. It's 6 parts, 60 chapters. And when you read it, you will be amazed at how much work the nose does to keep us balanced. And if I had to say in one word, and to your point, that's what I learned in flight school and survival training. We learned you can go 4 days without water, 4 weeks without food, 4 months without social behaviors, but you can really only go 4 minutes without breathing, because then you get into that collapse and hypoxia. And that's so important. But I think that breathing is it's such a common word. It's taken for granted. That's why I flipped the script to call it nasal function, because the nasal function is what helps us breathe, if that makes any sense.
Totally. And the funny thing is, this is how we met, because um, as we were working on nasal cleanse and we were going out and having people try it and use it, people with allergies, people with CPAP, or people with breathing problems, what we found was the first reaction was, I can breathe better.
Mm-hmm.
And I wanted to be able to quantitate that subjective feeling. And that's actually how we met, so that you could actually measure that.
Right.
Which is really fascinating. So
and
there's
you're
a
absolutely right,
massive
because
science behind this.
to your point, we did look at that. I'm trying to think, wasn't it about 15%? So we looked at two different endpoints. So I measured with the rhino-manometry, which is looking at the flow and the pressure of the nose with the machine, non-invasive, takes 15 seconds to gather the data. And I can look at the curves, almost like a ICU monitor, and look at the curves to see the improvement. What was really fascinating is that we did a baseline test, then we did the nasal cleanse gel, which I love, 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 love. And then we looked at it like 10 minutes later, and it dropped the resistance. So it works. And I think the impact and why it's such a valuable product is that when you look at that first turbinate, that's the turbinate, which I call the histamine turbinate, and has so many mast cells in there that it really impacts that and allows that air to come in. So it's not only a subjective feeling of improvement, it is really an objective improvement in breathing and nasal function and getting that air in. And that's powerful. And my
That's so
athletes love it, by the
cool.
way.
It's just so cool, because I think
Mhm.
there's something to the fact that the nose actually can sense that the moisture, and it reacts by opening up because it wants
Mhm.
more moist air to come in. Our nose is really very smart. The nose knows no boundaries. That's what I like to say.
Exactly.
So yeah, so I want to switch gears a little bit, and I want to thank you first for sending me a copy of your book. I just absolutely
Oh, you're
love it. I
welcome.
was planning to hold it up here, but then I realized I didn't have it with me. Can you hold it up for us?
Oh, let me stretch.
Because I love the
Yes.
cover.
Yes. So
There
that,
we go. So
and you can
cute.
find it wherever books are sold. Amazon. It's about 40,000 different distributing networks across the globe.
Wow. And the thing is, it's hard enough to do work and take care of a family like you do and do all the amazing things that you do. And yet you found time to write a book. So I'm so proud of you. And thank
Thank
you
you.
for sending me a copy. I love it. And I'm going to look forward to your next book. What do you think? I feel like we're going through a nasal renaissance. I just do. I feel like the
Mhm.
nose has not had its day in the sunshine. It's the center of our
Mhm.
face, but it's always kind of, just the forgotten part of our body. We just don't think about it. We don't give the nose enough respect. So
Yeah.
I'm hoping that together we'll be able to do a lot of work to help educate and inform people about how important the nose is and the heavy lifting the nose does. What do you think? Do you think people are going to begin respecting their nose more?
I think so. If you look at these trends, and again, it was 2017. I couldn't even say rhino-manometry. It was like rhino-mono. How do I say this? I couldn't even say
I
it.
couldn't either.
And everybody I talked to, they're like, Rhino what? And that's actually one of the titles of one of my talks, Rhino what? And I put that in my children's book with a little girl saying, Rhino what? That name sounds funny. It sounds funny, but it's so powerful. And when I think back to 1991, when I came into the healthcare industry, nobody was talking about it. Even in children's mental health, when I was in children's mental health in 1995 to 1997, it was under a federal grant. And so my caseload were children with ADHD. And by the way, ADD is no longer a diagnosis since 1987. But ADHD, OCD, oppositional defiant, and addictive behaviors. We never looked at sleep. We never looked at airway. And here we are 30 years later. It's like, bam, it's all over the internet. I love that. But I think the transition really happened
Mhm.
around the pandemic because here you had this virus traveling its way into the nose and into the lungs.
Yes.
And I was part of a research group looking at this, and they pulled me in for a medication spray in the nose. And I want to touch on that when we get to a point though. But I think during the pandemic is when it really exploded because here's a virus in the nose, it goes through apoptosis and it finds your way to the lung. Well, wait a minute. And I say this in the book. When you look at it, about 95% of viruses find their way into our body through the nose. And so it really is a gatekeeper. It's a gateway to our
Yep.
health, literally. And now we've had this new revolution, which I like. But I think sometimes, and you know how when patients come into your office, well, I was on the internet and I saw this on the internet. I'm like, get off the internet. Stay away from Dr. Google and Dr. DuckDuckGo.
I just feel it. I think the pandemic actually helped to educate a lot of people. You know, the fact that
Hmm.
people were wearing masks and covering their nose and this and that. I'm happy to say that we started our company before that, and I've had the idea for nasal cleansing and taking care of our noses since about 2008. Just didn't have time to really get around to it. But honestly, the deeper I get into it, the more important I find it is to our health. So I
Very
realize
much
that
so.
we've covered yeah, I realize that we've covered a lot of ground and we have a lot more to cover. What I'd love to suggest is that we do a second episode, if that's okay with you. I'd love to.
Absolutely. I would love that. Oh,
Oh,
we could probably have
great.
50 episodes.
Yeah.
I
Well,
mean,
I want to address sleep and athletic
mhm,
performance. Those two things are really big on my list. So
mhm.
maybe in our next conversation, we can talk about one or both of those things. I would love to do that.
Fantastic. I would love that.
Great. Great. In
Yeah.
the meantime, please let everybody know how they can find you and your book. And I just love talking to you and hearing all of the things that you've done. You're so amazing.
Oh, thank you. So, a couple things. I got frustrated with a lot of different societies in the medical community and the dental community. So, I created the International Society of Airway Function Diagnostics and Therapeutics. And I've also partnered with a few companies to do their clinical education to talk about the nose during pregnancy and sleep and athletics, things like that, to really educate the public. But my book is located wherever books are sold. And I wrote this
Awesome.
book because I felt I was part of the problem in the medical community where it was, do a diagnosis and give it a pill and off the patient went. I got frustrated with the healthcare system that I felt that patients were not getting what they really need. A lot of them didn't understand how to get access to the healthcare system, what to
Mhm.
do in the healthcare system. Who are all these people that want to pay attention to my nose? So I wrote it as a public education book, but ironically, a lot of the providers were like, I had no idea because I go into healthcare policy. I go into behind the scenes of the device companies and the pharmaceutical companies and how they have an impact on our nasal function and how we breathe. My website will be coming up soon, KarenParker-Davidson.com. But most of my work is on LinkedIn under Karen Parker Davidson and Instagram, which is at underscore the nose knows. So TheNoseKnows. And I think that we have so much ground to cover and get this information out to the public.
Yeah, and that's why
Mhm.
I'd love to package it in bite-sized pieces
Sure.
so people can digest it because there's a lot of science and you've done so much work over so long a period of time.
Oh, thank you.
Um,
It really is a science. And just to kind of recap, we have nasal congestion, we have nasal resistance. There are two different phenomenons happening. There's a lot of anatomical things that we can see or not see that can impact someone's breathing. Even their medications can affect their breathing by a side effect of being congestion. So I think that, with our conversation today, we know it's there. We know the nose is its own organ. We have a way to measure its function. And now we have
mhm.
data, nasal resistance, as a biomarker to kind of guide our treatment, guide our outcomes, and help these patients breathe better, sleep better, do better, and thrive, even in children.
Yeah, that's
Mhm.
great. I love that. Breathing is the source of all living. So
Survival.
let's do it well.
Exactly. And I always say, breathe easy, sleep well.
Awesome. That's a great way to end because everybody's having problems sleeping, except for me.
And me.
Go figure. Well, thank you again, Karen, for a great conversation. And I'm going to look forward to our next one.
Me as well. Thank you so much for having me. It's been a pleasure.